Hey everyone, welcome. Steph Poplinski here of Stronger Fitness, and today I have with me my friend, registered chiropractor Dana Poeta. We're at our clinic here in downtown London, and Dana actually specializes not only in sports injuries, but also in prenatal and postpartum. With C-section deliveries specifically, what are some things that you treat and that you work on with your patients?
So a lot of women actually experience a loss of sensation in their abdominal area, which then makes it hard to engage their core. They can't feel it. So a lot of working on getting some of that feeling back, working directly on the scar, getting the tissues to move independently of each other, because everything has just adhered together. So working on all of that is very beneficial. There's different ways that I do that. I work manually with my hands. I sometimes use instrument-assisted soft tissue, and I also use the Gorgeous Ball.
Now, for some women, thinking about, massaging or working their scar tissue doesn't seem natural or normal, because most people, I think, are told to rest and recover and let that heal. But why is massaging scar tissue and really working into that tissue so important?
So what happens when it's healing is our body is not focusing on healing each of the layers individually. It's just thinking about gluing everything together. But we need those layers to be separate because they function independently. So a lot of women start to develop that little shelf over top of the
little pouch,
over the scar, and that's just happening because of how all of the tissues are healing. The sooner you start to work on that, obviously you do have to wait till it is healed and closed, but the sooner you start working on it, the better. You can start working on these scars like years later, but you're not going to get the same result as you would if you started earlier.
Yeah, that's such an interesting point that I didn't even know about, the multiple layers and why you should work earlier to actually get those layers to essentially maybe not fully separate, but become individualized and act independently again, because we forget that, you have your internal, external obliques, you've got your rectus abdominis, that six-pack muscle, but then you've got like transverse, which is that deep muscle.
Yeah, the aponeurosis is right in there. And as well, you've got, the fascia and the skin, and it will all just start to bind together.
Yeah. And all of those muscles and tissues actually run in different directions.
Yep.
So that's why it's so important to actually massage earlier rather than later. Very cool. So, Gorgeous Ball, what are these things?
So these balls I recommend to women after they've had birth or given birth. These are amazing for anybody, but they're especially great for women who have had C-sections. So this is a way to mobilize the tissues in your stomach. It helps reconnect your brain with your core muscles. And there's a lot that you can do at home with these to help your recovery.
Yeah, I mean, off the top of my head, I was like, inner thigh strengthening, we might be able to do some other stuff.
Yeah.
But you said postpartum recovery. How does this play in the role of like C-section, massage, and scar tissue mobilization?
So what you actually do with this is you lie on it, and it's best if you do it skin on skin.
Okay.
If you've had a C-section especially, because it will somewhat grip to your skin, so it will help with the tissues and mobilizing them. And then you will do some breathing techniques on the ball, and you will essentially roll around on it and help get things loosened up.
So it kind of sounds weird to me to do skin to ball, because usually when you're doing any sort of rehab stuff, you're either like on your like clothing, or maybe you've got like oils or something that you're using. So what's the benefit of the skin to ball specifically? Because you want that stickiness?
Exactly. So the skin and the fascia essentially have adhered together. So we almost need a bit of friction to help get the movement between the two layers.
Makes sense.
I'm going to show you how to use the Gorgeous Ball. So typically you would be doing this skin on skin. You're going to lie on the ball and place it on your abdomen, just above the C-section scar. And at first you're going to feel your muscles tighten up around it. You want to take a deep breath in, engage all of your muscles, and then exhale and totally let everything relax around it. You're going to do that a few times just so you get comfortable. Once you are comfortable and feel like your abdomen is loosened up, you can start to roll side to side along the scar. If you notice that some areas are a bit more tight than others, you can place the ball in that spot and then you can actually walk your feet around. And with the ball sticking to your skin, this is actually going to help mobilize those layers. Now, when you're doing this, if you're doing it 6 weeks postpartum, you don't want to do it every day. You want to spend about 5 minutes every other day working on this. It can be a little bit tender, but it does feel great, and you should feel looser and like you have more mobility in your belly afterwards.
Dana, thank you so much for sharing all of your information with us today.
Thank you for having me.
Where can people find you?
So my clinic is located at 140 Oxford Street East. The clinic name is Mobilita Function and Performance.
Love it.
Yes. And my Instagram is doc.poeta or mobilita.clinic.
So check her out. Thank you so much for listening. I'm Steph Poplinski.
I'm Dr. Dana Poeta, and I hope to see you soon.